All right, today I'm going to demonstrate the complete 20-step draw using the multi-sample needle and tube holder. So this is going to be an ETS draw. The first step is always double check your order. Make sure you have all the information you need. You need the patient's full name, date of birth, the tests that are ordered, so that you know what you're going to be drawing. Next, you're going to come up to your subject and introduce yourself and let them know why you're there. Hi, my name is Officer Beth. I'm here to draw your blood today. Is that okay? So you want to get consent. If you can get verbal consent and signed on the consent form, you're good to go. Otherwise, you will need to get a warrant. We're going to assume that the subject today is going to consent. So we get consent. Hi, my name is Officer Beth. I'm here to draw your blood today. Is it okay? And the subject says yes. Then I make sure I have my order with me, and I say, can you please verify your full name and date of birth? And I want to make sure that the information coming from my subject is matching what's on my order sheet. Once I have verified that I have the right person and they have given consent, the next thing I need to do is look for a vein. So I'm going to take my tourniquet and I'm going to place it, if this is my antecubital fossa, my antecubital space where my veins are, 3 to 4 fingers above. So 3 to 4 inches above is where your tourniquet goes. And hopefully you have watched the video on how to tie your tourniquet, but we're going to learn how to do that in class also. You want your tails up and out of the way so that this area here is available and these aren't going to come down and contaminate your area. Once you have your tourniquet on, you will get your BZK antiseptic towelette. You're going to look for a vein. This is zone 1. This is where your median vein is. This is the left arm. So this is zone, I'm thinking now. This is zone 2, where the basilic, I can't even think of the names now. Basilic vein is, sorry. And this is zone 3, where the cephalic vein is. Once you have found your vein, and when you look for a vein, you're going to use one finger. So pick one finger that's going to be your dominant looking for a vein finger. A lot of people use their index finger. Some people use their middle finger. It's up to you, but pick one. You'll never want to use your thumb. You have a pulse in your thumb. You don't want to use that to find a vein. For finding a vein, you're going to find a vein that is springy and bouncy, and you're going to notice what direction it's going in, how deep it is, and how big around it is, what's the diameter. And you'll base your needle selection on those 3 things. If it's a very small, fragile vein, you'll use a butterfly syringe, but most of the time you'll be able to use the multi-sample needle. So once we find our vein, we pop our tourniquet, we get our towelette. They're huge, kind of weird. And we use that to clean, and you just scrub up and down. There was a time when they wanted you to start in the middle and move out. We do not do that anymore. Per CLSI, we do the scrubbing up and down. This can go in the trash. While that is drying, this needs to dry, so we're going to use the time while this is drying to gather our equipment. For this draw, we need our multi-sample needle and our tube holder. And in this case, we're just going to draw an alcohol, so we need 2 gray top tubes. Again, hold the needle in the center. This is the end with the needle that goes into the tube holder. This is the end with the needle that goes into the arm. So we hold it in the center, twist, and insert it into the tube holder, and it's ready to go. I can set this down. Once I have my tube holder and my tubes, I also want to make sure I have my gauze available and near my patient. I can pre-fold it into quarters, and if your table is clean, you can set it on your table. And I also want to make sure I have Coban available for the end of the draw. All right, so I'm going to reapply my tourniquet, and I want to make sure that I don't accidentally let the ends of the tourniquet drape across my clean area. If I do accidentally let them go across the clean area, I will have to re-clean and let it dry. I'm going to take this in my dominant hand, pull back on my safety, twist the cap, make sure that it's loose, and then gently take it off. This can go in the trash, but you can set it on the table. You don't want your needle moving around much after you've uncapped it. You want to be able to use it right away. With your non-dominant hand, you're going to anchor your vein. So if I'm going into this vein here, I'm going to anchor and I'm going to push on the subject's arm and pull down. I'm going to line my body up with the vein so that I'm in the same direction as the vein. I'm going to say you're going to feel a little poke, and as I say the word poke, I'm going to swiftly insert the needle. So I'm going to say you're going to feel a little poke, and I'm going to insert the needle rather quickly, about halfway. You want that needle in about halfway. I'm going to use my fingers to hold against the arm so that if the arm moves, I will move with it. And oops, I have my tubes on the wrong side. So I'm going to ask my assistant to put the tubes on the other side of the arm, both of them. Thank you. If I cross over while the needle's in the arm, that's a safety violation. If I reach under while the needle's in the arm, that's a safety violation, because the needle will move as you are trying to reach over. So now I have my tubes and my gauze. I'm going to insert my first tube. I do want you to be careful when you're inserting tubes. If you watch, it's like a little seesaw. If I push down on this end, the needle moves up. That's never good. So you want to make sure your tubes are inserted in a very neutral position. You're going to use your fingers. I'm just putting my hand underneath so you can see, but you would have your hand on top. You want to put your fingers on either side of the flange. Use your thumb to gently push the tube in so it engages. Now we have pushed back that little rubber cover on this needle. The needle is inside the tube. The blood can travel from the vein in the arm through this needle, and into the tube. Keep your hand here because sometimes these tubes can pop out. Once it's full, you're going to brace your finger against the flange. You're going to grab your tube with your other fingers. You're going to be pushing while you're pulling. And the reason we do this is if I just grab this and pull, it's going to pull the needle out of the arm, because there's a very good likelihood that it'll just take the whole needle right out. So I'm going to push and pull at the same time. And then I invert 1, 2, 3, 4, 5, 6, 7, 8. Set my tube down, pick up my next tube. Again, put it in a neutral position, gently squeeze, fill up your second tube. My second tube is filling. I'm going to reach up, pop my tourniquet, and now get my gauze ready. And I, again, brace. You can brace with your finger or your thumb. Brace with your finger, pull out the tube. 1, 2, 3, 4, 5, 6, 7, 8. And then I pick up my gauze, and you can quarter it in your hand. Gently hover, just barely touching the skin. Don't push yet. You're going to pull, push, and safety all in one motion. So now my needle is safetied. My sharps container is right here. I'm going to hover above my sharps container and let it fall in. Don't put your hand in there. Then I will ask my patient, can you please hold pressure here? And my subject. So while the subject is holding pressure, that is going to start the clotting process, and the little hole that you just made in their vein is going to start to close. That's why it's important that they hold pressure. If they are unable to hold pressure, you will have to hold pressure. While they're holding pressure, I can take my tubes, I can label them, and then in our clinical, you're going to use these labels, and you just have to fill out one. You're going to put their last name, comma, first name, date of birth, today's date, the time that you drew it, your initials. And then these, we're only going to fill out one per draw, just to save some time. But you will label both tubes. The label goes on the tube with the printing towards the top. There is an expiration date right here, 8/31/2023. So these are expired tubes, but they're still okay. And we're not going to cover the expiration date. So I want this at the top of the tube, And I want it covering as much of the front label as I can with it being straight, so that when I put the label on, the technician in the lab can see how much blood is in the tube. Once my tubes are labeled, I'm going to show them to the subject and I'm going to say, does this information look correct?
Yes.
And you have to verify that it is correct with the subject. Once your tubes are labeled, make sure you have your Coban. Oops. And try not to drop your tube in the sharps container. And this will be applied to the arm. So then you take the gauze back, say thank you, and then you have to lift it and count 1, 2, 3, make sure the bleeding has stopped. If the bleeding has not stopped, you will hold for at least 1 more minute and then double check again. If it hasn't stopped after 10 minutes, call EMS, because there are times when a patient is on blood thinners and may not, or may have a clotting issue. So if it doesn't stop bleeding within 10 minutes, you have to activate EMS and have them come out. So you double check, make sure it's stopped bleeding. You're gonna hold pressure while you're wrapping the arm. The minute you, because the clot is still forming on the vein, so if I am not holding pressure, it could pop loose and cause bleeding into the skin, which is a bruise or a hematoma, depending on how much blood. Then we push on this end, so now I have a nice little bit of pressure on the site, and I tell the subject, please leave this on for 15 minutes, no heavy lifting with this arm for 1 hour. How are you feeling? And make sure they're feeling okay. Look them in the eye. If somebody's gonna faint, you're gonna notice it in their face first. Their lips are gonna get pale. They're not gonna be as focused as they could be. So even if they say, yes, I'm fine, but they don't look fine, make them sit in the chair for a bit. Once they are fine, you can say, thank you very much. And I would say to tell them they're free to go, but I don't think they are at this point. So this is the end of this draw. And this tourniquet can go in the trash. We've already put our needle in the sharps, and now we take our tubes and we are going to put them in the kit as directed on the kit. That'll be a separate video. And that's it. Thank you.